So in this video, I'm gonna be explaining in my own words the two questions for the part 4 of electrical stimulation assignment. The first question is, in your own words, explain the impact of subsensory, sensory, and motor level e-stim on the inflammatory process. So for subsensory, there's not gonna be any sensation. It's gonna be right below the sensation where the patient's gonna be feeling it. So their patients are not gonna feel anything when it comes for the subsensory e-stimulation. And since there's not gonna be any sensation, there's not gonna be an increase of blood flow, or it's not gonna have any impact on the sensation at all. So the impact that it has on the inflammatory process, it will be that it provides um, cellular healing. So it increases the cellular activity to increase the healing process of the injured area. That's kind of like what it does subsensory. On sensory, since the patient is gonna have some slight sensation, is gonna start having sensation, but there's not gonna be any more beside the sensation that the patient is gonna have. The impact that over there is gonna be having on the chemical mediators. So basically, what it does is kind of like blocks out the chemical mediator of bradykinin, that is the chemical mediator that produces pain. Sensory is gonna have kind of like a block in there. Preventing that chemical mediator to keep passing through, so that way the patient will not be longer feeling any type of pain. That's the impact that it's going to be having in the inflammatory process. The impact is going to be in the chemical mediator acting against kind of like each other with the bradykinin mediator. And then for the motor level, the impact that it's going to be having in the inflammatory process will be in the swelling phase, since over there, motor level, there's going to be some muscle contractions, right? And since there are going to be some muscle contractions, it's going to be affecting the swelling, because of the muscle contractions is going to be kind of like increasing blood flow in the area. So by increasing blood flow, it's going to be pushing all that swelling away that is over there. So that's the impact that motor level e-stim is going to be having in the inflammatory process. And then for the second question, in your own words, explain the impact of sensory, motor, both high and low PPS, and noxious level e-stim on pain. So what the impact that they have on pain, first will be sensory. The impact that it has is kind of like activates the gate control for pain. So basically what it does is kind of like it ascends the A beta fibers. By ascending them, it prevents the patient to be able to receive pain from the A delta. So that's what it kind of like does. For the sensory, it ascends the A beta. Uh, since it activates the gate control and the A beta fibers to prevent that pain from the A delta to pass through to the brain. For motor, by the way, sensory will be high PPS. I forgot to say that a little bit earlier for that second question. For motor in low PPS, it's gonna also activate the gate control, but it's gonna make it a little bit different because it's not gonna activate the A beta. It's not gonna ascend the A beta. Basically, what it's gonna do is gonna be releasing opiates. It's gonna be having the release of opiates, which is gonna be which are gonna help decreasing the pain that the patient has. It's gonna be the same way through the gate control, but not ascending A beta. It's gonna be having a release of opiates with the low PPS. And then with the high level PPS, it's gonna be having a mixture of both. It's gonna be releasing opiates, but it's also gonna be having some effect on the ascending beta, which is gonna be increasing the A beta fibers also. It's gonna be having a small release of both. When it comes for motor, forgot also to say a little bit earlier, motor low PPS will be from around 2 to 4 PPS. and high PPS will be around 20 to 30 PPS for motor. Uh, for sensory, high PPS will be 60 to 120. Like I said, motor for high PPS will be having an impact of both. It's going to be having some release of the OPS, but it's also going to be having some effect on the ascending beta. And then for the noxious level, the impact that it has on pain, basically what it does is that it replace since that's gonna be muscle contraction, but it's gonna be higher than normal contraction. It's gonna be similar to as painful because the noxious level is gonna be into a level where the patient is gonna be feeling a lot of pain, right? But as tolerable, because not all the patients are going to be able to withstand that pain because they're already injured, so they're not going to be able to withstand another pain stimulus in the area. So basically what it does, the noxious levels pain, the way that it affects it is that it becomes kind of like the new A delta fiber, the pain stimulus, the nociceptors, and that's what kind of like it basically does. It becomes that the new A delta to be able to kind of like replace and take away that last A delta that it was of pain of the injury that he had by replacing it. Once a noxious E stimulation is done, it's kind of like pushing away that A delta that I had before. So it's kind of like erasing it, taking it out of the map technically. So that's kind of like the impact that noxious level is going to be having in the pain.